Assalamualaikum and hi, my name is Umi Atika binti Abdul Manan. So today, me and my friends Nurahwani binti Azmi will be presenting about Kendall syndrome. So, the content of our presentation including definition of the Kendall syndrome symptoms, the way to diagnose Kendall syndrome, the causes of the Kendall syndrome, and lastly the treatment of the Kendall syndrome.
First of all, let's start with what is Kendall syndrome. Kendall syndrome is a rare autoinflammatory disorder and it's often begin in early childhood. Kendall stands for chronic atypical neutrophilic dermatosis with lipodystrophy and elevated temperature. Kendall syndrome falls under broader category of autoinflammatory disease. Next, we move on to Kendall syndrome symptom. Firstly, in terms of skin involvement, which is people with Kendall syndrome will facing widespread skin rashes and swollen eyelid. Second, lipodystrophy, which is loss of fat in specific areas such as face, neck, and upper limb. The third one is elevated temperature. Individuals with Kendall syndrome will experience recurrent fever. Next, in terms of other systemic involvement, people with Kendall syndrome will facing muscle weakness and joint pain. These are few pictures of people with Kendall syndrome. The first picture shows that the girl has lost fat in her face. Second picture shows that the individual facing skin rashes on the body. The third picture shows that the girl's eyelid that having Kendall syndrome is swollen.
So next, way to diagnose Kendall syndrome. Generally, genetic testing is the only way to diagnose Kendall syndrome. It is done to identify the variation in genes or chromosomes. Okay, so next, causes of the Kendall syndrome. Firstly, mutation on the gene PSMB8. Genetic study has discovered that most of the people with Kendall syndrome have mutation on gene PSMB8. This mutation leads to accumulation of abnormal protein within cell since the proteasome cannot work properly. This accumulation triggers an overactive immune response and chronic inflammation throughout the body. The chronic inflammation causes the characteristic of the Kendall syndrome symptoms that had been stated in the previous slide. Secondly, mutation on other genes. Mutation on other gene encoding proteasome immunoproteasome subunits later than discovered in the patient with Kendall syndrome. And lastly, interferon or IFN. The inflammatory response of the patient with Kendall syndrome is theorized might be cause of dysregulation of the IFN signaling pathway. Lastly, Kendall syndrome's treatment. Until now, there is still no specific treatment for the patient with Kendall syndrome. Doctor can only manage their pain and symptoms.